A very good evening to one and all. Ladies and gentlemen, welcome to Pratignja. My name is Dr. Shyam Mohan, and I'm one of the co-founders of Pratignja. So today we are going to have an introductory session on the coming course on Pratignja, which is Agnikarma. And as a Shalya Tantra person myself, I can vouch for the efficacy of Agnikarma. I'm very sure you have all known teachers in your colleges who have done this and are, very good practitioners of this. But if you are new to Agnikarma, if you are new to Shalya Tantra, this procedure, this is the right place that you need to be. So let us start today's session. It's going to be, the class is going to be taken by Dr. Alex K. Abraham. So let me give you a brief introduction of Dr. Alex, and he will give you a basic idea about what are the things that will be covered during the class, and you'll get to know him also. So if at all any doubts you have, you can post it in the chat, and we shall try to answer afterwards after he is done his talk, and we will try to clarify as many doubts as possible. In the meantime, Dr. Rahul, one of the co-founders, will be posting the links to the to WhatsApp chats. If you are interested to join, you can click on that and join that WhatsApp groups, where we will be giving you more details about the class, and the brochures, etc., will be forwarded there. So Dr. Alex had done his UG from SN Ayurveda College, Puttur, and PG from Alvas Ayurveda Medical College. He is also had a FSR taken. He has conducted more than 13 hands-on trainings in Agniarma alone. He is right now he is a specialist medical officer, National Ayush Mission, Government Ayurveda Hospital, Ayur, Kerala. He is also a former professor, assistant professor at Parshinkada Ayurveda Medical College, and he was my colleague also, so I can vouch for his quality. And he has done a very good job on recording everything. So I hand it over to Dr. Alex for his introductory session. Dr. Alex, hello. Please unmute. Yes. Over to you.
So can you hear?
Yes,
Can
yes.
you hear
Over
me?
to you. Yes, Dr.
Thank
Alex,
you.
I can hear. Over to you. You can start.
Okay, thank you. Thank you. Uh, Good evening, all. Sir, I'm audible now. Hello.
Yes, you are. You are. You are audible.
Okay.
Please carry on.
Okay. Good evening, all. First of all, I would like to thank Team Praditya uh, for this opportunity, and also for bringing too many things on the table for the upcoming practitioners to learn few things and make it useful in their clinical practice. And also, I'm very happy to hear about the overwhelming response this program has received even before the intro session was on air. So it's a very glad feeling regarding the Praditya platform. On this Praditya platform, I'm planning to share a very few thoughts on Agnikarma, which is actually a very quite simple procedure. But unfortunately, or invariably, it is regarded as an asuri chikitsa, right? So, in my opinion, I feel it like it's the most underutilized and obviously the overrated procedure in Ayurveda. You all know Agnikarma is regarded as the epitome of all treatment. That is for Bheshaja, Shastra, Shara, Agni. So after Bheshaja, Shastra, and Shara, then comes Agni. That is that which does not get results with Bheshaja or Shastra or Shara, you will get results with Agni. This is what the normal norms are about Agni. So it's regarded like, is it the best treatment? Like it's regarded as the epitome of all treatment. Because when we look at the classics, they said like, because of it is superior because of its roga apunarbhavatva and shikragayatva. Obviously, so it's like a kind of a magic for us. And Shalaga is considered as a magic wand to treat untreatable cases. And Rahul, Dr. Rahul, I cannot see the slides actually. Is it shared? And Shalaga, we see it like a magic wand. And doing Agnikarma, it's like we are waiting for a magic to happen. And when that magic happens, what we will say? Oh, Acharya has written this 5,000 years before. This is something very proud moment, or it is something very special because Acharya had written this 5,000 years before. This is giving fantastic results. And when that magic does not happen, what we will say? This is that Acharya had again exaggerated few topics. This is pseudoscience. This is no value. This is not having any value. We had just wasted our 5 years. If we are done PG, then we will say we are asked for another 3 years. So, what actually does an Agnikarma do? So, what uh, purpose does that have, or does Agnikarma have any kind of scientific value, or is it worthy of a procedure? These are the things which make us not to make not which does not favor us in doing the procedure on a regular basis. I hope many of you are practicing Agnikarma. How many of you are practicing Agnikarma? Can you, if the chat option is there, you can just type it in so that I can know how many of you are really interested, or already you are practicing. Anyone is really practicing, I would like to know. So many hands are coming up. Yes, I am. So many are replying for. So many are practicing. Those who are practicing Agnikarma, that is the main issue behind practicing. How to make understand the public regarding this procedure. And we'll consider a case of tennis elbow. In case of tennis elbow, a patient came. We'll say, just imagine a patient came with tennis elbow. We'll examine him and see. Then we'll say, what, brother, this is tennis elbow. We'll do all the cautions test, all the examinations. We have confirmed it as tennis elbow. Then we'll say to him, brother, this is a tennis elbow. That he will just tell, doctor, I never played tennis. So yeah, it's not like that. We'll tell, it's not like that. It's because you are doing any kind of a ringing action, or using a screwdriver or something. You can get tennis. So he is convinced. Then we will just to exaggerate things, we will say Sachin Tendulkar had tennis elbow. So he will think, oh, it is really a proud moment for every Indian to get compared to Tendulkar, right? So he'll say, sir, what Tendulkar did he get cured of it? Then we'll be very skeptical about it, because Tendulkar went to Australia and did it surgery. So he got result from not from India. It's from he got results from Australia. So the patient will, if he's a school teacher or something, he'll just next question it will be, so there is no treatment in India, right? He will ask like that. So then we will say, if we have treatments, we have treatment options, then we need to explain them. What we will say, we are using a shalaga, which is very similar to a hammer-like thing, and we are heating it and then applying it over the lateral epicondyle. Then he will just ask straight in your face. He will ask, doctor, there will be burns, no? It's very hot thing, no? Shalaga is a metal, no? Then we will say, yes, shalaga is a metal. There will be burns. Uh, then the next question will be, how long will the scar last? And we had actually we are not sure how long it will last. Maybe 2 months, maybe 3 months, maybe 6 months, maybe 1 year. I had a patient whose burn mark lasted for around 3 to 4 years. So we cannot tell how long it will last. So what the patient will be, what patient will say next is, sir, you give me some medicines. I will come next time and definitely do the procedure, and make sure of it that he may not come back for this treatment. This is what happens with Agnikarma most of the times, because we are not being able to make understand the public how simple it is. And the next issue is how to overcome our own fear of doing it. Because even we are afraid to, most of it, we are afraid to do the procedure because we are afraid of the complications. So, do we need some alternatives for this? Actually, Acharya had mentioned many alternatives, like not just Chalaga. Acharya had mentioned, Saudra he had mentioned, Pippali he had mentioned, and so many things he had mentioned. Different types of Chalaga, different types of Loha, that is the materials with different temperatures, materials with different boiling point, materials with different melting point. He had mentioned so many things, so that just to avoid the complications, if we carefully select the material for that particular condition. So the material selection will depend upon what? Material selection will depend upon uh, the diagnosis or the tissue on which we are doing the procedure. In this presentation means in this series of classes, I would like to share my clinical experiences regarding Agnikarma. You may have suggestions, you may have difference in opinions, you may have different clinical experiences. I had seen few hands because many are practicing Agnikarma nowadays itself. Uh, so you may have different clinical experiences regarding Agnikarma. So keep this just as a platform to discuss these things more than a class. So just for the general idea regarding how the pattern of the class, we just discuss one condition, that is heel pain. So what is heel pain in Ayurveda? Obviously, heel pain in Ayurveda is always, every heel pain in Ayurveda, we will opt for Vata Kantaka. Rukpade Vishamanyeste Sramadva Jayade Tada Vadena Gulfamasritya Tamahur Vadaganda. That is because of an abnormal walking pattern or an abnormal food where there will be pain over Vada, that is food, and also due to the involvement of Vada in Gulfa, Vada Gandaka occurs. Like that is abnormal walking pattern or abnormal food wear or irregular walking surface, whatever it may, there will be pain over the heel. That is Vadagandaka. And the treatment for Vadagandaka is in which for treatment for Vadagandaka, Agnikarma is having definitely a high regard. And uh, but when we do Agnikarma, next slide, please. So when a patient comes to us with heel pain, he will be having too many stories to tell us, because if carefully listen to the patient, you will get the diagnosis. This is the truth. One patient will tell, sir, I had heel pain, I have heel pain for some long, or I have heel pain for the last 2 days, or I have heel pain from today morning. And he will tell how he gets the prashamana. So he will say, some will say, sir, I used heated bricks over the foot and I got pain relief. Some people will say, I had used ice pack and I got pain relief. Some will say, doctor, I just when I get up from bed, it was really awful or really painful. Then when I started walking in a plain surface, I got some relief. Some people will say, doctor, I had very severe pain over the foot or heel. Then when I started using MCR footwear, I got pain relief. Some people will say, sir, I used MCR footwear, but pain didn't go. But when I started using MCR footwear with medial arch support, I started getting pain relief. It was suggested by some doctor. Then, and rarely some patients will say, doctor, I started using heeled footwear, then I started feeling better. So there is a kind of difference in the pain relief methods. It's not always Vadagandaka or heel pain is not always about Agnikarma. It's sometimes about Shidakarma, or sometimes it may be about eyes, sometimes it may be about footwear change. So, what actually is Vadagandaka? What actually is, can we correlate just plantar fasciitis to Vadagandaka, or can we just blindly say Vadagandaka is plantar fasciitis? No, we cannot say that. It differs. So, not just Vada Kandaka, there is some space for Snayagata Vada also in case of heel pain. And also Abhigata Vigara can also be a part, because ice packing gives better results in some kind of heel pains. So there are some clarities actually very much required in case of heel pain and its treatment. Next slide. Next slide, please. Thank you. So all heel pains or all ankle pain or all gulfarujas are not Vadagandaka. In this picture, we can see some differential diagnosis. There you can see a fat pad atrophy. You can see there. It leads to plantar fasciitis. It can lead to fat pad contusions. Then calcaneal spur is there. Calcific tendonitis is there. Haglund's deformity you can there. Ankle sprain you can see there. Retrocalcaneal bursitis you can see there. Subcutaneous calcaneal bursitis you can see there. Achilles tendonitis you can see there. Tibialis anterior tendonitis, peroneus longus tendonitis, peroneus brevis tendonitis, so many things. So we need to differentiate these things and then do what actually is required. It's not the same treatment for the retrocalcaneal bursitis, and it's not same for the fat pad contusion or injury. It's absolutely different method or absolutely contrasting methods. But if we go for Activra in every kind of heel pain, it will be so disastrous. And uh, this is this is about the differential diagnosis. And one thing to say is all heel pains are not Vata Kandaka. Then next slide. And regarding the materials used, and Agnikarma is regarded like something is like all heel pains require Agnikarma Shalaga, and all heel pains require Shalaga Agnikarma. You can see three pictures there. Same person's foot, same person's heel, have treated for retrocalcaneal bursitis, in which one in which you can see there are no scar marks, absolutely no scar marks. Then in another one you can see a little bit bigger scar marks, and the third picture, right side top picture, you can see small scar marks. These are uh, treatment. This is foot of same person in which three things are used at a different time. One in which Shalaga is used, the other in which Pipili was used, and the one in which Shaudra was used. In retrocalcaneal bursitis, Pipili Agnikarma gives superb results. And Shaudra Agnikarma does not make any scar in retrocalcaneal bursitis. So you can select depend upon your diagnosis and your yukti. And your yukti should not always be a mirage. Your yukti should be your diagnosis. And Agnikarma is not always about inflicting burns. It's about inflicting heat. Just about inflicting heat. How much heat is required? That much you give. Not more, not less. That's what is required in all kinds of not just heel pain, any other condition. What is required, you give that, nothing more, nothing less. So you have to select according to your diagnosis and the temperature of that particular material. Uh, Next slide, please. And this is a case of mm, just pause it, pause it, pause it, pause it. Okay. And regarding the Agnikarma in an acute strains, acute a word strain means an injury. the question arises: can you use heat in a strain or heat in uh, an injury, or an injury is somewhere the blood vessels will be ruptured and there will be more blood. So can we use heat there? Obviously, we should not use heat anywhere when there is an injury. But in case of acute cervical spasms, Chaudhary Agnikarma gives superb results. Like you can see in that picture, first one. Can you play from the beginning? We just check on the cervical spine, neck range of movements. The person came with acute neck pain with restricted movements of the neck. When he just got up from bed, he had neck pain and the movements are really painful and restricted. Hope you have seen the lateral movements. Can you just play that again once more? First video. You can see there the lateral movements are restricted. Now, can you play the second video again? Second video. And the second video is just after maybe 2 minutes or maybe 3 minutes. And the procedure lasted about maybe 1 minute or 1 minute. That's it. The second video is after 2-3 minutes. Can you just see the movement, how much he can move now? Yeah. There is no magic in this. It's just about relieving the spasm. When the spasm is relieved, the patient is able to. That's it. And Chaudhary Agnikarma works superbly in acute spasms or whatever spasms or trigger points. It works really well. And the temperature record and all we will definitely discuss. And obviously that too without any sort of scar. Chaudhary Agnikarma, if you do it properly, there won't be any scar at all. There won't be any scar marks. Agnikarma about because in most of the people now they are present sophisticated world, they are always concerned about the complications and the scar marks and everything they are concerned, definitely concerned. So we need to make sure they go fine as before. After getting the results, there should not be any scar. Actually, scar marks, making a scar mark is not actually required at all. Without making any scar also we can get results. And in this series of classes we are planning for live demonstrations, not on patients, because it will be difficult to arrange patients in that time duration. So we will be arranging live demonstration with on each case, on heel pain, neck pain, whatever it may be. On each condition we say we'll be arranging live demonstrations. Then next one. Summing up, what we are trying to tell youngsters with this series of classes, the therapeutic methods explained by Ajahn Sushruta are definitely efficacious and without complications. But a kind of remodeling is required to meet the standards of the present sophisticated world. It's obviously not a magic, it's evidence-based and purely science.
Thank you, Dr. Alex. Wonderful presentation. Thank you for that. As Dr. Alex said, this is going to be something that even if you are practicing, you can start, because Dr. Alex is very good at recording, and all these will be taught to you also. So if you are, if you want to convince a patient to do this, you can. If you are doing this, let me now take some questions from the chat. If somebody has a doubt, you can ask in the chat, and I'll be able to help you with the any questions related to the course itself. We are going to start day after tomorrow, that is on 15th evening. So the timing is excuse me, the timing is going to be in the evening. Second. Yeah, all the details will be posted in the WhatsApp group that Dr. Rahul has put in the chat box. So if you're interested, you can click on it and join that WhatsApp group. All the details will be posted there. The details of the classes, again, I'll just give you the the topics that Dr. Alex will be covering. Diagnostic and treatment approaches in Agnikarma of heel pain. Will be diagnostic and treatment approaches in knee joint. Then we'll be taking the elbow joint and wrist and shoulder and spine. So these are the areas that will be covered during the class. The recordings will be provided for a period of 3 months, and those who are joining can get the recordings. Anything, if you are interested to have any personal queries that you have, you can contact these numbers, and you'll be able to get all the questions answered. Um, Background study we should do as a preparation for the study. I don't think you have to do it. Of course, you have a general idea about what is going on. Of course, this is only for BMS doctors. This is not going to be open for public. There are subjects that are open for public, like cosmetology, etc., but the other topics are only for Ayurvedic graduates. So please make sure, or at least the students of Ayurveda. So we are expecting that you should have a basic idea about what Agnikarma is and everything. Of course, Dr. Alex will cover from the basics itself, so that it'll be much easier for everyone to understand. Is there any other questions that is related to the this one? Yeah, if you are interested, you can raise your hand and I can unmute you and you can ask a question. If not, you can contact these numbers, and if you are interested to write a mail, you can contact us through mail, pratignja@gmail.com, and I think that's it. If you have anything to add, you can, Dr. Rahul, Dr. Anjana, if you have anything else to add, do let me know. Yes, Dr. Vidushi, anything you would like to know?
Yes, I want to ask few
Yes.
questions.
Yes, doctor.
Yes. Good evening, sir.
Evening.
Sir, I just want to ask whether in diabetic patients for wound
Yeah,
means
doctor, this is about the course as such. Any
okay,
subject related, you can go afterwards, so you can ask, I think.
okay.
Okay, thank you. So yeah, if you miss any session, recordings will be provided. Dr. Josna will be providing the recordings for a period of 3 months. I think that is clear. So just a thought from our side. I've learned that I still have a lot to learn. So keep learning every day. So that is our policy, and that is what we are trying to provide for the students, because there is always something out there that you have to learn. Always. This is our Pratignja, that promise to bring you the best of the topics, the best of the teachers for the topics, and thus give you the tools required to progress in your practice. So that is our basic aim. These are the co-founders of Pratignja. We have Dr. Anjana Unnikrishan, Dr. Rahul J, and myself. And I think that's it. Any other questions can be asked directly. As you know, we have already given you the number. So please contact those numbers, and you will find the numbers in the brochure also. So please contact us if you have any more doubts. Just a thought, keep learning, keep growing, and thank you. I think that's it. Thank you all. Thank you all for coming. Thank you.